You know, I think, night before last, a lot of places it was too cloudy. Last night, I think we were able to see this star last night, but with Jupiter and Saturn, I guess, crossing and the Bethlehem star, or I think is what it's referred to, it was really beautiful, beyond beautiful. I saw the pictures night before last, and absolutely beautiful. But today, 2 days before Christmas, there's a lot of West Virginians that are really hurting. Today, I'm going to read you that since Monday, we lost 65 more people in West Virginia. It's unbelievable. This thing is really tough. I'm going to read you a daily positivity rate of over 11%. And I'm going to read to you that this is going across our nation far worse than here, but it's still really, really tough right here. Bear with me, and not only bear with me, but please give respect in your prayers to each and every one of these great people. Our 1,130th death, a 77-year-old female from Cabell County. Our 1,131st death, a 67-year-old female from Cabell County. Our 1,132nd death, an 81-year-old female from Cabell County. Our 1,133rd death, a 79-year-old female from Cabell County. Our 1,134th death, an 85-year-old female from Greenbrier County. Our 1,135th death, a 79-year-old female from Monongahelia County. Our 1,136th death, a 52-year-old female from Grant County. Our 1,137th death, an 86-year-old male from Mercer County. Our 1,138th death, an 83-year-old female from Hampshire County. Our 1,139th death, a 67-year-old female from Lincoln County. Our 1,140th death, a 67-year-old male from Raleigh County. Our 1,141st death, a 92-year-old female from Preston County. Our 1,142nd death, a 70-year-old female from Monongahelia County. Our 1,143rd death, a 78-year-old female from Fayette County. Our 1,144th death, a 92-year-old female from Mineral County. Our 1,145th death, an 87-year-old female from Mineral County. Our 1,146th death, an 81-year-old female from Harrison County. Our 1,147th death, an 89-year-old female from Mon County. Our 1,148th death, a 93-year-old female from Hancock County. Our 1,149th death, an 83-year-old female from Wood County. Our 1,150th death, an 84-year-old female from Monongahelia County. Our 1,151st death, a 100-year-old female from Wood County. This is terrible. Our 1,152nd death, a 67-year-old female from Logan County. Our 1,153rd death, a 63-year-old male from Kanawha County. Our 1,154th death, an 87-year-old female from Preston County. Our 1,155th death, an 88-year-old female from Preston County. Our 1,156th death, a 48-year-old female from Mercer County. Our 1,157th death, a 79-year-old male from Preston County. Our 1,158th death, an 89-year-old male from Monongahelia County. Our 1,159th death, an 84-year-old male from Nicholas County. Our 1,160th death, a 92-year-old female from Monongahelia County. Our 1,161st death, a 78-year-old male from Hancock County. Our 1,162nd death, a 59-year-old female from Mon County. Our 1,163rd death, a 94-year-old female from Cabell County. Our 1,164th death, a 75-year-old male from Summers County. Our 1,165th death, a 94-year-old male from Hancock County. Our 1,166th death, a 91-year-old female from Monongahela County. Our 1,167th death, an 84-year-old female from Fayette County. Our 1,168th death, an 86-year-old female from Preston County. Our 1,169th death, an 88-year-old male from Monongahela County. Our 1,170th death, an 81-year-old male from Preston County. Our 1,171st death, an 82-year-old female from Mineral County. Our 1172nd death, a 74-year-old female from Hampshire County. Our 1,173rd death, an 80-year-old male from Cabell County. Our 1,174th death, a 71-year-old female from Morgan County. Our 1,175th death, an 80-year-old male from Wood County. Our 1,176th death, a 61-year-old male from Mason County. Our 1,177th death, an 84-year-old female from Hancock County. Our 1,178th death, a 69-year-old female from Mineral County. Our 1,179th death, a 61-year-old female from Kanawha County. Our 1,180th death, a 97-year-old female from Ritchie County. Our 1,181st death, a 61-year-old female from Marshall County. Our 1,182nd death, a 99-year-old female from Greenbrier County. Our 1,183rd death, a 78-year-old male from Mineral County. Our 1,184th death, a 74-year-old male from Mineral County. Our 1,185th death, a 78-year-old male from Kanawha County. Our 1,186th death, a 91-year-old female from Raleigh County. Our 1,187th death, a 67-year-old male from Marshall County. Our 1,188th death, a 78-year-old male from Clay County. Our 1,189th death, a 69-year-old female from Kanawha County. Our 1,190th death, an 81-year-old female from Putnam County. Our 1,191st death, a 71-year-old female from Taylor County. Our 1,192nd death, a 91-year-old male from Cabell County. Our 1,193rd death, an 82-year-old male from Monongahela County. And our 1,194th death, a 97-year-old female from Jackson County. You've got to hear me along the way sigh or say to myself, gosh, I hate this, and I do. I have now read to you 1,194 people, their age, and their county. 1,194 great West Virginians. It's really sad. Really, really sad. We have 1,199 new positive cases in the last 24 hours. Our daily positivity rate is at 11.51, and our cumulative rate now is at 4.46. We have active cases that are almost 23,000 and recovered cases just short of 52,000. We have 737 people now hospitalized in West Virginia and 175 in our ICUs. Yesterday, we didn't test that many West Virginians. We tested 6,053. Today, we have the fourth worst in the country, this reproduction number of 1.11. We have 46 of our 55 counties in the red and the orange. And I go back to this, and I really want you again to pay so close attention to just this. If you're 65 years of age or older, and you get what I refer to as a sniffle, you think it's a cold, you think I've got a headache and it's nothing, you've got to be tested. and you got to go get tested right now. That's all there is to it. Because if you're tested right now and it were to happen to come back positive, we can give you these antibodies, and they're absolutely miracle drugs, and it'll make you well. That's all there is to it. But if you're 65 years or older, and really and truly you wait, and you just mess around with it and everything, and then all of a sudden 6 or 7 or 8 days later, we find out you are positive. I'm telling you, your probability of dying goes through the roof. You have got to run to the fire just like you would with a heart attack or a stroke. At the first symptoms, run to the fire and get tested. If you're tested and we find it, we'll get rid of it to the very, very best of all of our abilities. If you're tested and there's nothing there, you go home and you feel good and your anxiety level drops, and absolutely it'll help you all across the board. We know that 77.5% of the people that are dying are old. Now, old doesn't mean 65 is old, or 70 is old, or even 80 is old. I read to you names or people all the time that have lived in excess of 90 or 100 years of age. We want you around. We want you around for your knowledge, your experience, and all that you can give to all of us. You got to help us. You know, as far as I took the vaccine now 10 days ago, feel great, no problem there. You know, I can tell you that West Virginia is still leading the nation in getting the COVID vaccines out. Today, there's been 18,488 doses in West Virginia administered, and we have 60,000, you know, almost 61,000 doses that are now arriving or have arrived in West Virginia. You know, we want to just keep pumping it out and everything, and according to Bloomberg, West Virginia is still the highest administration rate in the country, and every day, remember that this rate will change every day. We won't end up the first in the nation when everybody just starts catching on and everything. But what we will have done by being first in the nation is we'll have saved a bunch of people from going to the funeral. That's all there is to it, you know. And so that's what we want to continue to do, and we want to continue to lead the nation in every way. And you've done great, West Virginia, and all the people that have been a part of this. Way to go. Within the first 2 weeks of the vaccine distribution, we have gotten vaccines out to, now this doesn't mean they've been put in the arms, but we've gotten this vaccine out to 100% of the health departments, 100% of the long-term care facilities, and nearly all of our acute care hospitals. Healthcare workers will be completed within 3 weeks. I want to read this to you that over 10,000 West Virginians, including primary care providers, rural health clinics, free clinics, home health, hospice providers, urgent care, and federally qualified health centers will receive vaccines this week on top of the work we're doing with our long-term care facilities as well. By focusing on vaccinating the healthcare professionals, you will be giving the vaccines to the rest of the population as well, or who will be giving the vaccines to the rest of the population as well, so we can keep the momentum going and keep them safe. You know, if the people that are on the front lines that are doing the work, if they get sick or they fade away, we got real problems, don't we? Now, as far as our long-term care facilities, we're again still leading the nation, in getting these vaccines out to our nursing homes and our assisted living. We are making significant progress in our plan to offer vaccination to all of our long-term care facility residents and staff. We should be complete by the end of this week, and that means we will have offered vaccines to all 214 facilities in the state, far ahead of any other state. And I want to just read this little note that I have here. It says, compared with what's going on in West Virginia to, let's say, what's going on in Texas. And Texas is a pretty, novel state. They get it done and everything else, but just think, Texas is using the federal program to vaccinate long-term care residents, nursing homes, assisted living, and so on. That program isn't going to start vaccinating its people until December the 28th. So Texas isn't even going to start until September the 28th. Meanwhile, we're on track to finish distributing our first round of vaccines to every single one of these facilities in the state by December 28th. And when you adjust for our population, we have nearly twice as many people in these types of facilities as Texas does. So when you adjust for population, and let me just narrow it down and make it really simple. When you adjust for population, the percentage of people that we have in nursing homes and assisted living is half of what Texas is. And Texas isn't even going to get started until we're done. Pretty good stuff. Pretty good stuff. I want to remind you again about the vaccine. For crying out loud. I heard this on the way down here. I heard this, that there was a couple of kids, and they were 18 or 20 years old, and they said, we're not going to get the vaccine, we're not going to take it. And I said, well, why is that? And they said, because the people that are taking it now are the guinea pigs, and really and truly, we've heard that if you take this vaccine, you could grow a third hand. I'm telling you the truth. I am telling you the honest truth. Where does this come from? This doesn't come from kids. This comes from adults that are scaring these kids to death. I mean, where in the world does this nonsense come from? I mean, do you not believe in your mind that with tens and tens and tens of thousands of people that have been tested by our FDA and all the people in CDC and all the people that are working this in every way, do you not believe that you are exposed, who knows how many multiples of times, by not having the vaccine versus having the vaccine? Let's just don't be silly. Dr. Amjad, if you would talk a little bit about how we changed the protocol on our antibody treatment and everything, to be able to have these doses in a lot of different places and everything, and not just at hospitals, and be able to get them out to the people, and basically for the long and the short of it, that's the stuff that that President Trump got, and that's the stuff that'll make you well and make you well really quick if we can get you identified and get it to you quick. But Dr. Amjad, talk just a second about that, please.
Sure, Governor. So those are the monoclonal antibodies that some people have probably heard on the news that President Trump got, and then even Rudy Giuliani. So Regeneron is one of them, and the other one is bamlanivimab, or the Lilly drug, or monoclonal antibodies that most people have heard of in the media. And as the governor stated, and he said on several briefings, if you're diagnosed with COVID-19 and you fit the criteria, and if your doctor believes you can have this drug early on in your disease, you can speak with your doctor or go to one of the hospitals if they have this drug available. And there is criteria that you do need to meet to have this drug. And we do have that available in West Virginia. And what the governor is referring to, there is an emergency use authorization for this drug. One of them is, if you're above 65 years old, have chronic kidney disease, diabetes, have to fit a certain weight criteria, or if you're above 55, have cardiovascular disease, or greater than 17 years old. But there is certain criteria that you do have to meet to qualify for this drug. This drug is also utilized in the nursing homes a lot. We have been using that in several nursing homes already over the last couple of weeks. It has been known to improve mortality rates as well in nursing homes and across the emergency room population. It is not used in hospital settings. It is used as an outpatient setting, but that is what we've been referring to several times on the briefing, and what you've also heard, President Trump used, as well as other things in the media. But that's what we've been talking about, that you can talk with your doctors about. But it is available in the state of West Virginia if you meet criteria in an outpatient setting. But you have to be diagnosed early on in your disease. And it's not something used in the hospital setting, but you can speak with your doctor about it, and it's also available for more information, but definitely need to be diagnosed early with COVID-19. Thank you.
Okay, there's the child care subsidy extension. You know, we stepped up and we made a commitment, and this funding was really exhausted at the end of August. And we said, no, we're not going to do that. You know, and we stepped up and allocated an additional $6 million, you know, to be able to continue to fund this and everything. And as of November, there was 4,778 children of essential workers and 3,002 West Virginia families that have been served. Now think about that. You know, that's almost 8,000 people in West Virginia that we've been able to help with this. You know, we expect to receive an additional $60 million in stimulus money, you know, from the new bill. And however, you know, whatever it takes, you know, I'm absolutely going to continue to fund this. This is an absolute essential beyond belief. And so any of you that are out there that are recipients and everything, just sleep well and everything, that everything's going to be fine, and we're going to continue to fund. I'll go through this stuff as quickly as possible, but continue to get tested. It just continues to help in every way. One of the things that we're working on like crazy is we want to try to find a way to be able to aggressively test. We want to do it every week if there's any way that we can afford it and it can be done. We want to do it every week to be able to test all the kids at all of our colleges and universities and everything, because those kids that are 18 to 35 years of age and everything, those people, a lot of those people are carrying this thing around and they don't have a clue they've even got it. And you know, as they come in contact with, you know, whether it be a person, you know, that a loved one at home or whatever like that, it just spreads and spreads and spreads, and we don't know where it's coming from. We don't have any idea where it's coming from until we can catch it with these people. Free testing is all up there. The drive-through pharmacy stuff is all up there. You know, our school outbreaks are minuscule, but for the most part, we're not in school either. But our school outbreaks are 11 outbreaks now with 49 confirmed cases. You know, I've said it over and over, the people, anybody within our Department of Education, you know, teachers, service personnel, all the people that are putting in the licks, all the health care and the guard and everything, incredible job. Incredible job. You know, our long-term care facilities, the outbreaks are down a little bit. We still got 111. The outbreaks at our churches are 17 and 15 counties. I always read these counties: Braxton, Greenbrier, Harrison, Jackson, Lewis, Marion, McDowell, Mineral, Mingo, Monongahela, Nicholas, Raleigh, Summers, Webster, and Wyoming counties are where these churches are at, and they have these outbreaks. We have 247 inmates today that have this, including 77 at the Eastern Regional Jail. We have 74 at St. Mary's. We have 38 at the Central Regional Jail. And at the Tigard Valley Regional Jail, we have 25 inmate cases. Over and over and over, I tell you, wear your mask, please wear your mask. If we had not done this, great goodness alive, we'd have probably been South Dakota and then some. You know, there's not many people that move around in South Dakota, and they were on fire. And there's a whole lot of people within a rock's throw of West Virginia all over the place. Get your flu shot, give blood. Give blood and plasma if you possibly can. It's really, 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 really important. Now, outside of the COVID-19 announcements, I got something I'm really proud of and really, really proud of. We had a gentleman that just retired, as our chief of staff, Mike Hall. He did a great job. I love Mike to death. And Mike's going to continue to work with us, but he's going to go on and do other things with his life, and that's great too. We've replaced Mike with a superstar that has been my general counsel, a true leader, that's for sure, in every way. And that's Brian Abraham, and I could not be more proud. He also serves as the chair of the Joint Staff in the West Virginia National Guard. But he's a veteran, and he's an experienced attorney who loves our state probably as much as I do, to tell you the truth. And I know all about his skills and his experience, and he's been an unbelievable general counsel, and I guess we'll have to replace Brian in that, but I'm sure that we know the fellow who's going to do that, and he's going to do a great job as well, or the young lady. But nevertheless, what an honor it is that I announced yesterday, we actually put the press release together yesterday and turned it loose this morning that as of January 1st, our new chief of staff in my office will be Brian Abraham. And Brian, congratulations in every way, and we're really proud of you, and I know you'll do a wonderful, wonderful job. That's all I have, except I want to do this now, and I'll do it again later. Who would have ever thought that last early days of March, when this started to become all over us, who would have ever thought that we'd be able to see the next March and we would see what we're seeing today? Who would have ever thought that it'll be Christmas, in not long? Well, not long would have been 10 months from that time in early March, a long time ago. Well, it's almost Christmas, and this thing is really tough. And there's been 1,194 people die. Now listen to me. You got to be super careful with your family right now. Super careful. And absolutely, as sad and as terrible as it may be, you may need to really not bring your family together. And if you do, you really need to have masks on, everybody, and they need to be not there for very long. You may have to do a lot of talking on the phone, a lot of prayers on the phone, and a lot of love on the phone. But nevertheless, I know in my heart that God above has got this, and He's handling it. Maybe He's not handling it on our timetable, but it never works that way. It always works on His timetable, and He knows He'll get us through this. He expects us to do our job and to fight as hard as we can and show up and do the job. He doesn't expect us to sit on the porch and just let Him just make it all go away. He expects us to absolutely let Him lead and give Him the credit for all that happens all around us. But He expects us to work. So with all that, we work, and we'll get through it. Please remember everybody at this incredible time of year, Christmas. So I'll wish you Merry Christmas now, and I'll wish you another Merry Christmas as I close. But thank you so much.
Thank you, Governor. Let's now go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. As the governor pointed out, exceptionally aggressive schedule today. We are delivering to 173 facilities We appreciate the support from Department of Homeland Security, LNOs who are helping us, as well as Department of Agriculture and West Virginia State Police, all doing great work to help us get to those sites. 28,000 of the 44,000 additional doses that have come in are out and in motion right now. Number of people have asked about the integrity of the system and how this works. And Jordan, I believe if you have the video, we can roll it and we'll talk through how this works. National Guard personnel receive the items from UPS, FedEx. They pull them out appropriately. They log the items in. It's double checked by multiple members of the National Guard at these hubs. And then it is pulled out for distribution. It gets packed in bubble wrap, placed in a container, iced appropriately, and then a thermometer placed in along with a GPS device. The items are then packaged appropriately for delivery. Upon arrival at the site, the container temperature is then checked again. And at the end point of delivery, the receiving entity will then log that data back into the system, which allows for us to double check that those items have been received. So a lot of significant effort goes into this. Folks, please understand again, this week we are managing 2 different doses under 2 environmental constraints. So a lot of work done there, and also are preparing for the doses to go out on the second shot within a couple of weeks. As the governor mentioned, we're 10 days in to those folks receiving the first shot. Thank everyone from the Joint Interagency Task Force led by Joe Peel and the team there for the great work that's going on. And on behalf of all the members of the West Virginia National Guard, happy holidays, Merry Christmas to everyone. We will continue to press to achieve the governor's objectives of getting our most vulnerable populations vaccinated as quickly as possible. Thank you.
All right, thank you, General. Next to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon, and following with what the governor said and with what General Hoyer said, we are very hopeful and thankful for the great work of all West Virginians during this really dynamic and unprecedented time. So we know that going into this holiday, the behaviors that we exhibit and the approach that we all take to this holiday season is going to make a huge impact on what happens over the next month or 2 months. So from cell phone mobility data, we know that there is more people so far moving and traveling during this holiday season than we saw over Thanksgiving. Over the last 4 days, we've seen 1 million people a day go through our TSA lines and our airports. And this tells us that people are going to visit others during this holiday season, which is part of fellowship, part of togetherness. But although we do really very much support the coming together of people and collaboration and connection and community, which the governor has really, been focused on keeping our state together, keeping people pulling the rope in the same direction as so critical. But it's also critical that we all bear an incredible focus on our personal responsibility to protect ourselves and to protect each other. Because as we know, the risk to us in West Virginia is overwhelming some of our healthcare assets. Our hospital beds are more full in our country and in our state than they have been before. We have seen a kind of a stabilization, although we still have a lot of people sick with COVID in West Virginia hospital beds. And as the governor said, we're seeing people die of COVID-19 at a rate in West Virginia and around the country that we really haven't seen before. So it's really, really critical for all of us to be very, very responsible during this time. Now, as we look at the next phase of our vaccination strategy, it is important to recognize that we are starting a transitioning approach, and it's important that each one of you who is listening understands what we're heading for. So the first phase is the governor has asked us to be focused at maintaining critical capacities in our hospitals, our healthcare sector, and also in our community and our state by making sure that first responders and EMT professionals and folks that really serve us are getting vaccinated. And as the governor said, our nursing home residents, as we look at those people, then we know that they are among the highest risk group as far as dying and going into the hospital. And as people's age increases, we know that the risk of having those people get severely ill with COVID, rises, 220 to 630% from people that are 18 to 29-year-old, and that is the 75 to 85-year-old group and the 85 and over. And as we look at our strategy, and we have been amazingly effective, and that's really to the great work of General Hoyer, Joe Peel, the Joint Interagency Task Force, the DHHR, and all of our affiliated members who've been contributing so amazingly and working together to serve West Virginia. We're really proud of that. But we are really going to focus, we're going to move our focus from hospitals and nursing homes where we have a great concentration of people, and also healthcare capabilities so that we can take care of those vaccines and administer those vaccines in those facilities, to now starting to look at people who are working in those industry sectors that are critical, like teachers and utilities people and people that work in the food service industry that aren't so centralized, that are distributed through the state. And importantly, to get to our elderly, the people that are at the highest risk of hospitalization and dying from COVID-19 are 70-year-olds and over, which account for 77.5% of our deaths, and our 60 to 70-year-old group, which account for an additional 14.25% of our deaths. And these people are in every community and every part of West Virginia, not just in the cities, but in the rural parts. So as we start to look at expanding our footprint, our capability from pharmacies, which we're working with now to be able to move the vaccine close to everybody's front door to these different communities and parts of West Virginia, we are now going to focus at vaccinating the vaccinators, the people that will take up that challenge to vaccinate folks in rural communities and every community, which include 33 federally qualified health centers, rural health clinic, physician practices, hospital-associated clinics, so that we can immunize those people and their staff who will be reaching out and helping us continue to test and to vaccinate people in these groups. And as we said, the governor said, our vaccination plan is not sequential. We don't just finish one part before going to another. We do it in a way where we are serving people in those high priority areas, but we're also moving very quickly to get to our most vulnerable, our aged population. And at the governor's instruction, we have been able to immunize our nursing home population before any other state, and we'll be finished with that. And the governor has committed to us to make sure that we tell you guys that we also want to be first in vaccinating all of our West Virginia residents who are over 70 years old who agree to get the vaccine. And we would heavily recommend you get the vaccine. And this move now is to create that structure, that foundation, that availability in every community in West Virginia for each person who is in that priority list, and particularly as we look at our essential workers, our other healthcare workers, and then as we look at our elderly population, so that you can get the vaccine, so that we can not only keep West Virginia open, but we can save lives. And as we look at this holiday season, we reflect on what we know and we cherish, which is each other. And the root word of health is also the same root word of heal, and the same root word of holy, and the same root word of holistic. And it means whole, W-H-O-L-E, all of us together. And as all of us commit to support each other and to serve each other with the altruism and the love and the connection and the commitment to community and family that each one of us have, West Virginia, you will continue to shine for the rest of the country. And for me as a citizen, I could not be prouder to be serving each one of you as part of this great team under the governor's leadership. So thank you so much.
All right, thank you, Dr. Marsh. Dr. Ayn Amjad, our State Health Officer, and Bill Crouch, Secretary of the West Virginia DHHR, are also joining us today and are available for questions. We'll now go to questions from members of the media. The first today from Steve Adams with Ogden Newspapers.
Yeah, Steve Adams of Ogden Newspapers here. Merry Christmas to the governor, all those on the panel, and my fellow reporters. Question, and I know you all have said this, but I feel like it's been couched a little bit in some medicalese and jargon. And the thing I'm getting asked about in regards to this is our focus, particularly as we go through the phases and the subcategories in the phases. And like has been said, this is not all being done necessarily one after the other. You're trying to do what you can within those phases. But obviously, age has been the focus, particularly in these briefings as of late. And so the thing I'm getting asked is particularly in these categories where you're talking about healthcare workers, or you're talking about first responders. And it says this on the various graphics you all have put out. But the goal within these sub-tiers is getting people that are in that risk range, particularly the age range, for 50 or 60 up, that are in these subcategories. The goal is getting these people vaccinated, obviously before someone younger that's not in that risk range, but is in those specific subcategories within the phases. That's the goal, correct? And I was kind of hoping to have someone kind of put that in some language that general people can understand. Thank you.
Stephen, let me jump in and just say this. First of all, Merry Christmas to you and all your family in every way. Stephen, let me tell you, from my standpoint, this thing I've said many times, this thing has been fluid. It changes. We had to tweak. We had to change. We had to adapt. All of that is still going on in every way. But right now, to me, it's perfectly clear that we need three giant categories. And I've said this over and over. But the three giant categories is the first thing is we need to focus on age, and age. The second giant category that we need to focus on is just this, that anybody, and just more get the message out than anything, anybody that really, truly is 65 and older, that has any symptom whatsoever, and they feel that, they got to treat it just like it's a heart attack or a stroke. They've got to run to the fire. And the last thing is just this, that if they get tested, as Dr. Amjad just said, or as we've said over and over, what we're going to try to do is we're going to try to get these antibodies to our assisted living people, to local pharmacies, to different locations to where we can get them to the people, because once you get these symptoms, hours are important, not days. It's hours are important, and we can save your life, So that's Roman numeral 2. Roman numeral 1 is all about age. Roman numeral 2 is all about timing and the antibodies. And Roman numeral 3 is really simple. We know that our younger people aren't getting really bad sick and all that for the most part. And our younger people that have this and are positive, we don't have any way of finding them hardly, because there's only a very small percentage that are going to get a test because they don't have any symptoms or any reason to go get a test. So that, from the standpoint of testing all of our colleges and universities, will really help us. Now, from the standpoint of the technical stuff, really getting down in the weeds, General Hoyer, maybe you can tell us more about the methodology that we're going to, and just break it down and make it just simple as mud as you can possibly try to make it.
Yes, Governor. And Stephen, you're right. Within the various phases and the categories, the initial primary focus is on age 50 and above, with the breakdowns from 50 to 60, 60 to 70, 70 and above. So we try to work through each of those groups. I think the best way, as an example, in our essential workers, we'll focus on those higher age essential workers, because we know from what the governor and Dr. Marsh put out, 77.5% of the people over the age of 70 are those that we have lost. We know, and Dr. Marsh has some new data from the WVU health system that shows in those same age categories a much significantly higher rate of hospitalization. So to get to the governor's objective of reducing the loss of life and reducing hospitalizations, we're focusing on those age categories within those various phases first. Thank you.
All right, thank you, Stephen. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass. Merry Christmas to one and all. Hope you have a good holiday season. Governor, there are reports that President Trump is not pleased with the bill that came out of Congress. He has not threatened to veto it. The last things I've seen are that he wants to send it back to Congress to, among other things, increase the individual payment to Americans from $600 to $2,000. Democrats say they're on board with that. There's not been much response from Republicans. So I'd like to get your thoughts on that. And also, very quickly, with any money the West Virginia has from West Virginia's share of the CARES Act, have you considered chipping in and either matching or adding to whatever federal aid could be coming to state residents? Is your plan at all involving adding to the whatever amount comes out of Congress with a state share that would help beef that up and help people who are in critical need of aid? Thank you, sir.
Well, Kenny, we've done that, and we will continue to do that. But the first and foremost responsibility, and I'm going to answer the tail end of your question first, but the first and foremost responsibility that I see it as your governor is just this, is to make sure that the holistic approach, the absolute approach to all the dollars that we had, we're handling that in a way that best fits our entire economy, all of our people, and whether it be from the standpoint that you've got a road to store all the pieces and you can't hardly get to a medical facility, or it be that you're a small business that we want to send $5,000 out to immediately and everything, and we thought we were going to have 30,000 apply and we only had 3,000 apply, and so with all that being said, whether it be, protecting our, unemployment fund so that we don't just turn around and nail our businesses with something that's on their back as they've already suffered through this whole thing, and now their unemployment rate shoots straight through the roof. To absolutely do all the things on the chessboard and to do them the right way, that's my first responsibility. My second responsibility is just do this. With dollars that I can have, and I can do something with those dollars because we've got extra dollars and we can help the people, that's exactly what I did when the president came out with his $400 per week to everybody, but the federal government was only going to fund $300. And so we funded $100 to all the unemployed. It cost $38 million to do that, but we did it. So we'll continue to do what we can. We're going to mind the store first and foremost, and we're going to continue to try to do any and everything we can to help. Now, from the standpoint of the first part of your question, the president has come out and said $600. I mean, really and truly, $600 is a lot of money to a lot of people. I get it and everything. But $600 doesn't go nearly as far as $2,000. And to two in a home getting $4,000, That's a real bump, and that is real security in lots and lots of ways. I am 100% behind what our president is saying. I am absolutely just as, I can't say it any more blunt. I have said it over and over. If you're fair, if you're really fair, you have got to be nauseated beyond belief watching the politicians of D.C. Why in the world, why on this earth would Nancy Pelosi turn down $1.8 trillion deal, or $800 billion deal, turn down a deal that was $1.8 trillion and accepted a deal at $900 billion, half? Why did they do that? Why did they do that? They did that because they were trying to defeat Donald Trump. That's exactly why they did that. The president and his people offered up $1.8 trillion deal. And they turned it down. You know why? Playing politics. Playing politics with your lives. You're not going to see that out of me. You're not going to see a situation to where I'm just doing special projects for my buddies, or I'm just doing special projects for the Republicans or whatever. I look at this as my job is for all West Virginians. Absolutely, I'm all on board. If we can give $2,000 to our families, or $2,000 to individuals, and $4,000 to our families that are out there and they're hurting, do it. For God's sakes, a living, do it. That's all there is to it. And I don't care if it pushes back on the Republicans or it pushes back on the Democrats. It doesn't matter to me. It's the right thing to do.
All right, thank you, Kenny. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. I wanted to ask about the plans to notify these different subgroups that we just talked about when it becomes their turn. I'm thinking of someone that's older, maybe doesn't drive anymore, has limited internet access. How are we going to let those folks know it's their turn, and how are we going to make sure that they can, get where they need to go to receive it? Thank you.
All right, guys, General, I know you can answer this a lot better than I, but just hold up just one second, because maybe I can answer it quick enough that we can move right along. One of the challenges is just this. We have got to present this in ways, and this is where the General is a superstar. We have got to present this in ways to where people can do two things. They can know when it is available to them, and they can know where to go, and then they can get processed and get through there real quickly. The General's doing that. He's all over that. Our health teams are all over that. We had all kinds of discussion about that yesterday, but General, you go from there.
Yes, sir, Governor. So at the Joint Interagency Task Force, the various groups, constituent groups, representatives of organizations are brought in to help us prepare. Also within the Joint Interagency Task Force is what's called the Joint Information Center. And it works to put the messaging out that the governor alluded to in his comments there. And we try to focus hard on getting information as quickly to the most available groups. A good example is we know that a large portion of the older population are served by regional or local clinics, as well as the FQHC, so information will be pushed out. By using the primary care network, those that have primary care providers, information will be pushed out that way. But primarily, the Interagency Task Force works with the various constituency groups. The Joint Information Center puts data out across various media. Thank you.
All right, thank you, Charles. Next to Katie Coyne with the Charleston Gazette-Mail.
Thanks, Governor. Today, I know that we're talking a lot about vaccine distribution, but I know that there are still a lot of unknowns in this process, and it's changing every day. But as we look at the general population, there seems to be a lot of questions here about how people will access these, whether it will be through pharmacies. And I'm mostly wondering, going back to something Dr. Marsh mentioned last week about how those with pre-existing conditions will take a doctor's note to be placed in a higher tier. who will be the arbitrator for that? Who will decide who gets moved up and who needs to wait until their turn? And what is going to go into making those decisions as more vaccines become available? Thank you.
Okay, Dr. Marsh, hold up just one second. I'm going to pass to you in just one second. But Katie, that's where we've pivoted and changed just a little bit. You know, naturally, we're going to look at the sickest and try to take care of those people for sure. But really and truly, just exactly what you said is a real life problem. You know, we want constant food fights with the local pharmacist being the arbitrator, and one person saying, well, I've got more sickness than you've got, and therefore I should be vaccinated now, not you, and everything else. But really and truly, Katie, all the research really boils right back down to this. If you're 65 years of age or older, we need to be dealing with age. That's all there is to it. Now, Dr. Marsh, go.
Well, thank you, Governor. And Katie, you know, the governor is spot on. We are really focused on getting immunizations in the arms of our most vulnerable, you know, after serving the critical infrastructure areas in phase one. We do, though, want to make sure that people who do have doctors' orders to get vaccinated early also have that opportunity as we're looking at these phases. And so we will take all of those into account, and we will vaccinate every West Virginian in a way that we believe will have the highest likelihood to save lives and reduce the stress on hospitals for the people that are the most likely to be hospitalized. Thank you.
All right, thank you, Katie. Next to Paul Mullen with WCBC.
Good afternoon, Governor, to you and the First Lady, to Drs. Amjad and Marsh, General Hoyer, and also Secretary Crouch of Heartfelt Merry Christmas. Dr. Marsh, at the beginning, when we first received word of the vaccine, made mention that the development of this vaccine also made some breakthroughs that would make future vaccines maybe a little bit easier to come by. I'd like for him to comment that in the spirit of hope in the season.
Dr. Marsh, that's yours.
Thank you, Paul. Well, I think that what's really important to recognize, both about the vaccine, but also about this response and about our governor's leadership, is that we are really focused today on COVID-19, but what we've accomplished together and continue to accomplish will really be a part of our bright future of improving the health of the state of West Virginia. So as we look at these vaccines, the Pfizer vaccine and the Moderna vaccine, these vaccines are made with a newer technology that allows us to express a genetic code that is synthetically generated that can instruct our bodies to respond to very specific parts of a virus or a bacteria or whatever we want to respond to. And this allows us to really accelerate the time in which we understand the target that we're going after and that we can create the vaccine that can be a very effective one in inducing our bodies to respond very precisely to only that part of whatever we direct our body's immune response to react to. And so as we look at the future, the availability to really customize and design, vaccines and other approaches, and the governor's talked about our antibodies that are used to treat people really early who may be infected, who've gotten infected with COVID, who are in high-risk categories. These approaches really can be transferred to other infections in the future. And we know that we're always going to be challenged with something else. And West Virginia, I think, has proven really almost uniquely to be able to respond as a team and a community under the governor's leadership. And I think that this is really a step toward having West Virginia be a model as a healthy state in the future. And that's something we're really all committed to.
All right, thank you, Paul. Last question today comes from Audra Lasky with Nexstar Media.
Hi, this is Audra Lasky with Nexstar. Merry Christmas to everyone. Now that the Moderna vaccine is approved and is seen more viable for rural areas because of the refrigeration process, Senator Manchin yesterday said that West Virginia would be receiving more of these vaccines. Could you tell me a little bit about how you plan on distributing these vaccines when you have two different vaccines going to different areas? Thank you.
General Hoyer, this is you. You got to do this better. You can do this better than any of us.
Yes, sir, Governor. So, as you point out, two different environmental control systems. Part of what we have done initially is focus the Pfizer vaccine near and around the hubs so that it takes less to maintain those temperature controls. As was pointed out in the video, we have a pretty sophisticated process to manage that environmental control piece. The Moderna vaccines, as you point out, are better suited for further distance out in rural areas because of the ability to maintain them in a normal refrigerator and freezer. So we look at each of those things as we push vaccines out to various locations in the state to make it more acceptable for those who are doing the end use administration to be able to maintain that environmental control effectively.
All right, thank you, Audra. Governor, I'll turn it back to you.
Well, again, everyone, we're 2 days before Christmas, and I wish you absolutely the merriest of all Christmases. I want to tell everyone that just this is, we're going to come in on Christmas Day, and we're going to give you your briefing, and we're going to give that at 1 o'clock to you on Christmas Day. I don't really see that we need to take a lot of questions and interrupt the media and everything, but I do feel like we need to be here. And, because between now and next Monday is a long, long time. And a lot of you are probably going to be awfully concerned and wondering what's going on. And I think the least we can do is be here and try to give you an update as best we possibly can. So we'll be here at 1 o'clock on Christmas Day. And again, I wish all of you the merriest of all Christmases, surely a Happy New Year. But with all in me, I know in my heart, with all in me, that God's in control, and absolutely we're going to get through this. Protect yourselves in every way you possibly can. He truly does expect us to do our part. Protect yourself every way you possibly can. Get vaccinated when you have the opportunity. Wear your mask at all times when you go outside or you're going into a public building. Absolutely continue to enjoy all the beautiful nature this state has to offer, but truly protect yourself and protect your family. I mean, we're not there yet. I read 65 names today. 65 people that died since Monday. 65. Again, those people are surely struggling at this wonderful time of year. So for all of them, offer up your prayers. And again, Merry Christmas to everybody. Thank y'all.